White I can get away with. See, look, evening dress, black.
Jude Tyson has been suffering from menopausal symptoms since she was 36. She's now 55. Jude has experienced severe symptoms including hot flashes and night sweats. She has resorted to wearing black and white clothes to minimise the embarrassment.
Night sweats are really bad. It affects what I wear, where I go, where I stay, what I do. I don't do clothes shopping because you can guarantee as soon as I put that clothing on, my body's going to give out and I'm going to end up sweating in people's clothes. I don't like to stay at houses, even my family, even though they know I'm going to have a major sweat in your bed. Holidays are the same.
Jude works as an audiologist testing the hearing of newborn babies on warm hospital wards. She says she has learned to deal with the hot flashes at work.
If I feel it coming, I can be a bit of a devil. I'll pretend I've got a pager in my pocket. And I say, I'm sorry, I was waiting for a baby. Pager's just got, I'll be back, and I'll go. And then it'll take about 5 minutes, anywhere from 5 to 7 minutes, for the body to calm down. Sometimes I need to change my pinny, sometimes I don't.
Clinical exercise specialist Jane Dowling is helping Jude deal with her symptoms through diet and exercise. Jane also hosts a blog to help women cope with menopausal symptoms.
We've seen a big shift with women having to work longer than ever before. We're a higher percentage of the workforce than ever before, but unfortunately women during menopause are not supported in the workplace. So we need to go into the workforce and make cultural and leadership changes.
Government figures suggest the proportion of British women aged 50 to 64 with jobs has risen by more than 50% in the past 30 years. Dowling leads workshops to educate companies and organisations about menopause. She says she's received great feedback from women who didn't know how to discuss their needs with their colleagues. This coincides with research by a team at King's College London, which concluded there was little awareness of the impact of menopause on working women who are often at the peak of their careers. Dr. Claire Hardy led the research and says menopausal women reported the need for small changes to make them feel more comfortable.
Sometimes it can be really simple things. If there are desk fans available that they can have on their desk to help them cool down, if they can move their desk next to a window that can be opened, that would be useful. Cold drinking water is something else that women have said would be useful.
Dowling says she's on a mission to help other menopausal women feel they can discuss their needs in the workplace.
Women have hot flushes. It's really embarrassing. It's really quite debilitating. And if somebody is having a high rate of hot flashes, they might think, crikey, I don't want to go into work today. Then they would stay at home, which is not good for their mental health. Then their finances might be affected. So it's a domino effect.
Dowling says employers who are flexible can make all the difference. Support groups who work with women going through menopause have welcomed this research and say women must not be afraid to discuss their needs in the workplace. They say companies must support women at this time in their lives or else risk losing their productive workforce. Catherine Drew, CGTN, London.